Assalamu alaikum. Welcome to the angio suite at King Fahd Hospital of the university. I'm going to show you the endovenous ablation of varicose vein using laser technology, which is very efficient and new treatment modality for those patients. Our patient today, Mr. Alex, he's 42 years old with the history of varicosity for the past 2 years. He has a heaviness, a pain and long standing, which limit his daily activity, and on Doppler ultrasound, the greater saphenous vein was dilated, measuring around 8 millimeter with great reflux at the saphenofemoral junction. So I'll just quickly identify my teams. Miss Susan, Dr. Adnan, and Miss Miriam. Okay, so we'll start now. Give me the mask. خلي السكرين هنا عند السكرين كاميرا.
السكرين اوكي دكتور.
Also, before I forget, we are using angiodynamic machine, which is 810 nanometer from Tamer company. We are using the 4 French golden tip fiber, which is the latest in the market. Okay. So, screen, please. Now you can see the greater saphenous vein very clearly here. It's dilated. It's measuring around 8 millimeter with some debris within, indicating sluggish flow within those veins because of the dilatation. So when you go down, you can see multiple venous tributaries and tortuous course of the vein. So better things to puncture the vein at just above those tortuosity, just to navigate the guide wire easily through the vein. Local. And Alex, local anesthesia.
Your hand, doctor.
Okay, then I puncture the vein, and this is the very important step in this procedure. Now you can see the needle on the vein. Once you are in, just aspirate to make sure that you are in the vein. Then we have good right flow of blood. My hand, please. And we'll pass the guide wire. Pass the guide wire to the vein. I will remove the needle. Then make small skin incision just to make passing of the stent easily. Of the sheath easily. Okay. This is a 4 French micropuncture system in which you can introduce the 6 French sheath. Light, please, light. Let's see. Release the tourniquet. Can you open it? Okay. Give me the paper. Then we will exchange the 4 French system over guide wire. Give me the long sheet. If you have any question, please, you can ask me. Passing the sheet inside the vein. Then I'll check the position of the tip of the sheet. Give me some light, Now the position should be within 2 centimeters from the saphenofemoral junction. Now this is the tip of the sheet. Here you can see it very clearly. Now I'll pull up the sheet a little bit. Okay. And just I will remove the guide wire with the inner sheath. Okay, now this is put the camera please here. This is the laser fiber. This is the golden tip. Here is the laser energy will generated. Okay, it has usually, sorry? Naam? Yes, yes? Yes, I'm hearing you. I'll show it to you just when I will, let me just place the fiber, then I'll show you the exact. Yeah, I hear. Okay. Okay, now we have the tip. Now you can see the shadowing of the sheet over here. Now this is the tip of the sheet. As I go down, I'll push the sheet. As I go up, I'll push the sheet. Then when I reach to the junction, I like to make it a longitudinal. Now this is the junction. Can you see it? Okay, this is now the sheet it's in, and this is very careful step in the procedure because you can easily calculate the common femoral vein. So your tip should be at least 2 centimeters away from the junction. Okay. Now the junction is very clear the tip. So I'll mark it here probably almost 2 centimeters from the junction. Okay. Then I'll later, before I start the laser, also I will check it again. I'll check the position. Now we have the next step will be the tumescent anesthesia delivery. So probably some people using a pump, Klein pump. Some people they are doing manual. Klein pump is very useful, of course, because it will save some time. Mr. Alex, I'm going to break you a little bit, huh? Okay. Now you can see my needle just around the vein. You can see the vein now very clearly, surrounded by tumescent anesthesia. If the patient is slightly obese, we can use a spinal needle. Okay. Sorry. We usually injecting within the saphenous space or saphenous fascia. The advantage of this tumescent anesthesia is it can compress the vein wall against the fiber, so it will maximize the contact time between the laser fiber and the vein during laser delivery. Also, it helps in separating the vein from the surrounding structure. In addition to its analgesic or anesthetic effect. Now as we go up, the veins slightly become more deeper, so I might use a spinal needle at this stage. If the position of the needle tip within the saphenous fascia, you're going to anesthetize one segment of the vein without and decreasing the number of needle prick to the patient. And as you can see, this procedure wholly can be done under ultrasound guidance, no need for any x-rays. It is an outpatient procedure. Patient can leave immediately after the procedure, after walking about 25 minutes. Our patient is actually very cooperative today. All what you need to do this procedure is just familiarity with the ultrasound guidance procedure, knowing exactly what is the exact position of the fiber tip. Also, you need to be familiar with puncturing the vessels because spasm is very common in this area. You have always to have a plan B when you have a spasm of the vein, because most of the time, once you get spasm of the vein, most of the time, you will cancel the procedure or reschedule the patient. Okay. فصل؟
فصل تليفون مرة ثانية.
لا يا شيخ.
اتصل بس.
بس احنا almost finishing. يلا عطني ايوه. ها؟ إيه، خلاص. وين هو التليفون؟ ما أدري وين. حطيت السماعة؟ إيه. يلا اوكي sorry for this technical problem. خلاص. شلون حطيت؟ امسك وسكت على Okay. You can hear me now? Can hear me now? Hello? Do you hear me? Zakaria? Do you hear me? Okay, good. Okay, I'll continue with the tumescent anesthesia. Just infiltrate around the vein. Good, yeah. Okay. So now we finish the tumescent anesthesia. We'll check the position, final position of the tip of the fiber before we start laser. Now again the tip is here, and this is the junction. So still we are in a good place. We are in a good place. Okay. Can you put the camera here on the machine? Yeah, the machine already connected now to the laser fiber. Give me goggles, please. Goggles. Open. Close one. No. There are different modes to use. I am using continuous mode. Some people using pulse mode. يلا البس النظارة. And there are some other different mode. There are many machines in the market. No one is better than the other. Almost they have comparable outcome in terms of closure of the vein. However, some of them are less painful than the other. And now we have in the horizon new fibers, which is 14, 17 nanometer. It's very promising with very nice result and less pain. Okay. Khalas now, okay. Everybody in the room should wear a goggles like this to protect your eyes from the laser energy. Okay.
وين كام دكتور؟ سكرين؟
حط السماعة. Screen. Okay, good. Now I'll show you just a little few seconds, just the appearance. Don't worry. Huh? Goggles for Alex. Give him your goggles. Give him your goggles, yes. And give him your goggles. Yeah, you said you forgot the patient. Go out. Okay. Okay. Just to show you how to usually to reduce acoustic shadowing during the laser. I'll show you just in the first few centimeters of the vein. So, just a little button, little notch. There you are, press it. Yes. The other one. This one. Yeah. Very good. So we are ready now to go. Okay, we are starting. You may feel some pain at the beginning of the procedure, Mr. Alex. Now I'm pulling back the fiber, you can see. You can see this shadowing echogenic material with the shadowing indicating coagulative necrosis. As we're pulling back, okay, usually I pull slowly. Okay, you can see. As we pull out, there is some echogenic shadowing, like look, this one, coagulative necrosis of the vein. Okay, you can monitor the whole procedure by ultrasound. You don't need more than this. Okay, just can you put the camera on my hand? Just to show. Okay, usually I like to press in the middle aspect of the thigh just to maximize the contact between the vein wall and the fiber. Now because of the light, we cannot see the laser light, which is red usually in color here through the skin, but usually in optimal situation there is no light except the laser light. Then once you see the marker at the sheath, which is this marker, please focus here, this marker, that's mean you are going out of the vein, and if you continue here you will burn the skin. So at this point you just compress and take the fibers out, and that's it. We finished the endovenous ablation of varicose vein.